Dr. Kapadia. I'm Chief of Cardiac Surgery here at Global Hospital in Health City, Chennai. We do here a lot of complex and routine pediatric work. And Dominic, who is a 9-month-old child, mother actually contacted us 2 months ago and described that child had a hole in the heart. And they came here, and when we did the echo, we found that child had multiple holes in the heart. Routinely, they have a single hole in the heart, which we close, and technically is not very difficult. But this child had unusual 3 holes. At the apex of the heart also, there were 2 holes. Now, besides, the child also had a obstruction at the level where the blood flows to the lungs, what we call it infundibular stenosis, and that was a big surprise, because that, if left after closure of the VSD, can cause a problem when the child grows. So here what we did, we closed all the VSDs, then we resected this obstruction. Child did very well in the post-operative period. The total surgery takes about 2 and 3 hours, between 2 and 3 hours. The recovery was good. The only problem this child had, this airways are slightly smaller, because when they have a hole in the heart, most of the blood is recirculated, so they don't grow. Now, since the holes are closed, the cardiac output, the heart function will improve, and the child will grow. And maybe after 6 months, even mother will forget that any surgery has been done. And it's the only surgery which is curative, you know. And we offer this surgery here for packages which are really competitive, because most of the children from Africa, they go to South Africa and Kenya, where the surgery here costs about $6,000. There it costs about $25,000 to $30,000. And we have an excellent unit here. And I'll now invite Dominic's mother to share her experience here.
I'm Mrs. Sopanabog. My child's name is Dominic Anabog. We are from Nigeria. We came here with the problem of ventricular septal defect. My son was diagnosed of having ventricular septal defect in Nigeria when he was 4 months old. So we were directed from Nigeria by a pediatrician to here in India. So I'm very grateful for everything here in India here. The diagnosis was very okay. The diagnosis in Nigeria and the one in India here is the same. When we were I'm so grateful for my doctor, Dr. NKD Kapadia, who has been there for us directing us in every step we are taking. In fact, he made our stay a pleasant one. I came here with a heavy heart when I heard my child had ventricular septal defect. I was so confused. Now I'm very, very happy, because immediately after the surgery, I saw a dramatic change in my son's body. The breathless, everything was okay now. He fits very well. He's now very, very okay. I'm so happy. I wish to express my heartfelt gratitude to Global Hospital. Global Hospital is a place to be. It's a home for all. They have good and well-qualified doctors and nurses, very humble workers. I think if I'm asked to identify Global Hospital in 2 sentences, I would say that I'll use hospitality, I'll use humility, I'll use endurance. They have good and well-qualified doctors, very humble doctors in Global Hospitals, good equipment. In fact, I'm short of words.